like me better when I wasn't yours. I'm going back, I'm going back, I'm going back, I'm going back, I'm going back to who I was before. I like me better, I like me better, yeah.
What's good? What's poppin', Golden Bays? Welcome back to my channel. My name is Dominique if you are new, and if you are new, welcome. Make sure you go ahead and hit that subscribe button that is located down below. Also, make sure you hit the bell so you can be notified whenever I upload. I post a lot of videos, of course, here about nursing. I also post vlogs and things like that, so definitely hit that subscribe button and the bell so you can know whenever I upload. And of course, if you are a returning Golden Bay, then welcome back. Thank you so much for tuning into another video. Let's go ahead and hop straight into this video. I'm going to be telling you guys what a nurse extern is, etc, etc, etc. So to begin, you guys know that I just recently started my nurse extern position. I've been there for about 3 months now. I believe my first day was on January the 6th. You guys came along that journey with me. You guys got the announcement and everything like that. So now that I have about 3 months of experience, I can finally tell you guys more about my role, what I've been doing, and things like that. So to begin with, what is a nurse extern? What is it? I've never heard of it. So a nurse extern is someone who is currently enrolled in a nursing school. So that is the requirement. You do have to be enrolled in a nursing program. Now, hence, every requirement is different, and I will get into requirements later, but a nurse extern is someone who does not hold a license. I do not have a special license or anything like that to be a nurse extern. You just have to be enrolled in a nursing school program that, of course, your hospital recognized as being eligible, accredited, things like that. So now that you know what a nurse extern is, your next question may be, what do you guys do? So I'm going to be 100% honest with you guys. You guys know that I never sugarcoat. I tell you guys what it is, what it's not, and stuff like that. So a nurse extern is pretty much a CNA. So you do CNA work, and I will explain what CNA work is in case you are unfamiliar. I will get into the nitty-gritty, but if you are familiar with what a role of a CNA is, then that's exactly what you do. However, you do get to do nursing role things as well. You just have to have a nurse present, and that is the upside of being a nurse extern. So again, if you are unfamiliar with what a role a CNA plays, I have a list right here of some things that I found, and it is exactly what I do. So as a CNA, you assist patients with grooming, bathing, you know, those who have low mobility. You take care of the patient's room, so you make sure that they have clean sheets, clean blankets, things like that. You do change beds, you do bathe patients, you assist patients to the bathroom with ambulation, things like that. You assist patients with eating, you assist them with taking medications. So it is just basic care that you provide to the patient as a CNA, and that is exactly what you do as a nurse extern. So nurse extern, they have the best of both worlds. You do those basic care things, grooming, ambulation, things like that. However, as a nurse extern, you are allowed to do nursing role things, meaning, do I pass medications? Yes. The only thing is you have to have a registered nurse in the room while you're doing something. So I am allowed to pass medications. I've started a million IVs, I've hung a million IV poles, things like that. So you are allowed to do nursing role things, and that is the only rule about being a nurse extern, which is you have to have a nurse inside the room, which makes sense because I don't have a license yet. So if you have a nurse in the room and you don't know what to do next, or you know you do something wrong, you have someone who can come in and say, hey, you know, before you do this, before you make this mistake, you want to do this, you know. So it's kind of helpful too because you are doing it, but you do have another nurse in the room, you know, kind of looking over your shoulder, which I like. It definitely, you know, helps my nerves. You know, when you go inside the room with the patient, it kind of, you know, helps you to have someone in the room. They do just stand in the corner and they let me do my thing. They let me introduce myself. They let me, you know, check the patient identifier, first name, last name, date of birth. They let me do everything. They let me pull the meds out. They let me, you know, get the meds ready, start the IV, pull all the IV stuff out, the IV kit. They let me do everything, but it is nice to have that person stand by you and say, okay, you know, you did this, or you know, you did this. It's definitely very helpful, and you do learn a lot as a nurse extern. How would I describe a nurse extern? I would definitely describe a nurse extern as a well-paid CNA, because you guys know that CNAs, they don't get paid the greatest and they do a lot of work. But as a nurse extern, of course, you will be making more than a CNA. However, you'll be making less than a nurse, and we'll get into that when we get into pay. But that is how I would describe a nurse extern, would be just a well-paid, or honestly how much they should be paid because they work so hard, a well-paid CNA. So now you know what a nurse extern is, what they do, their scope of practice, and things like that. So what are the requirements? So please guys, keep in mind that I do live in South Florida, and of course every state and every hospital's requirements differ. So always look into your state and the hospital that you are looking into working at. Look at their requirements because they may be different than mine. So again, you guys, I do live in South Florida, and my requirements to become a nurse extern was I needed to be complete with my second semester of nursing school. Now again, I am currently in my third semester out of 4, so I do have a total of 4 semesters, but I needed to be finished with at least my second semester, which meant that I had at least 2 years of clinicals under my belt. So definitely, again, take a look at what requirements your hospital or your school has in order for you to become a nurse extern. Now that you are in the nurse extern role, what else is required? Once you get that position, or once you know, before you begin to start, what else is required? The same things that are required of you in nursing school are the same things, thank God, that are required for you as a nurse extern. So things like your BLS card, so your basic life support, those things you already have because you are in nursing school. Well, at least for my school, I know we have to have a current BLS card. Also, you have to have all of your shots and vaccinations updated, and again, that is something that was already required for school. So all I did was take those same records and I literally just gave it to the lady at my job, and it was easy peasy mac and cheesy because you have all of the paperwork already done. It's just a matter of collecting all of that paperwork and getting it over to the hospital. So requirements, just look into whichever, you know, hospital you are looking into, look at their requirements. Also, once you get inside, you will have, of course, some health requirements that you have to obtain, things like vaccination records, things like that. You may also have to get some blood drawn. I did have to get blood drawn as well, just to make sure, you know, like my Hep B was still in my system, things like that. You also have to do like a TB shot. These things are not new because, you know, we already did them for nursing school. So 9 times out of 10, you are good to go. All you have to do is get them your paperwork and you are set to start. So your next question may be, okay, I'm interested, but how do I find these nurse extern positions? So you have 2 big resources, you guys. Your first resource is, of course, your professors in your school. Reach out and say, you know, I'm interested in nurse extern positions. Have you heard any? Things like that. They can help you there. Either your professor or, you know, you have academic advisors. They are able to help you find these type of opportunities in your field. Also, you guys, go. You guys, always look on Google. Type in nurse extern positions near me, and I promise you guys, a whole list will pop up, a bunch of hospitals and things like that, and just go from there. You guys, those are your 2 major resources. So when I began to look for nurse extern positions, I already knew that hospitals around me was doing it, so I didn't even like go to my professors or anything like that because I already knew. So what I did was I went to Google and I searched in nurse extern positions. So the hospital that I work at is actually a tenant hospital, and if you are unfamiliar with what tenant means or what it is, it's just a network of hospitals, if that makes sense. It's like sister hospitals. I think it's like 5 down here in South Florida, because Kelsey, if you guys watch my vlogs and stuff like that, then you guys know Kelsey. Kelsey also works at a tenant hospital, but she works at one up north and I work at one, you know, down here near me. So we are all in the tenant family, if that makes sense. They're just sister hospitals. So when it came to choosing a hospital, I already knew where I wanted to go, because you guys know that I want to be a trauma center nurse, and there are only 2 trauma centers here where I live. So it was either choice A or choice B. So I went ahead and I went on eTenant and I applied to the job that I want. So I went ahead and went on eTenant. They do have a website, and I went ahead and applied to the specific hospital that I want. Again, there was only 2, so I only really had 2 options, but One, of course, was higher. Like, I wanted one more than I wanted the other, so I was gunning for one. But of course, if I did not get that one, then I would just go to option number 2. But I did go ahead and apply to every tenant hospital in my area, just in case I did not get that one hospital that I wanted, and there was another hospital that of course was willing to accept me as a nurse extern. Now, when it came down to, you know, choosing and stuff like that, I did get a call back literally from every single hospital. Thank God I got a call back from every single hospital, but of course the one that I wanted came through, and that is currently where I work. Because in my eyes, you guys, their trauma facility is, it's a level 1. They have the chopper pad. Like, I'm so excited to work there as a trauma nurse, and I will talk to you guys more about, you know, tips on choosing hospitals and things like that. But I was really happy when I got a call back from this specific hospital, because of course that is where I want to work at as a nurse, and it's just one up because I already got my foot in the door as a nurse extern. And especially because sometimes I just go down to the trauma unit and I talk to, you know, the charge nurses and stuff like that. So when it comes time for me to become a nurse, they're like, hey, I remember Dominique from, you know, neuro step down, you know, things like that. So I'll talk to you guys more about tips and things like that when it comes to choosing a hospital. My apology, guys, if you see a, you know, frame change. My camera died, so I had to go ahead and put in a new battery. But let's hop right back on track. Let's get into interviews. So again, I am going to have a separate video all about interviews, but I do want to, you know, touch a little basis on what to expect and things like that, and a few tips and tricks. So the first thing, of course, is appearance. You want to make sure you're going in there, one, very professional. You know, you definitely want to stay away from strappy things. If you can, have a nice cardigan, a nice blazer. If you are going to wear a skirt, for my ladies, make sure it is length appropriate. I would suggest something that is near your knees. It doesn't have to be past your knees, but definitely near your knees. You do not need to be rolling up in there with a skater skirt, okay? Don't do that. Also, you know, shoes, if you want to wear heels, make sure it's something that you can properly walk in. Make sure they're not too high either. I am a flats girl. I will throw on flats so quick for an interview, you know, because it just gives you that baby doll look. Very subtle, very, you know, professional. Next up is hair. You want to make sure your hair is back, it's clean, it's up, especially because we are interviewing for a hospital position. You already know, as a nurse, the one thing that they say is your hair needs to be up. So make sure your hair is up. That is the best choice. If it cannot be up, at least push it back. You just want it out of your face, okay? Another tip that I wanted to share with you guys is to definitely walk in there with confidence. You know, the recruiter reached out to you because they think that you are a good candidate, a good fit for this hospital. So you need to walk in there with your shoulders back, walk up straight, sit up straight, chin up, you know, walk in there with confidence, because you bring a lot to the table. Even as a nurse extern, as a nursing student, you bring a lot to the table. So you need to walk in with confidence and show them, tell them, like, I am fit for this position. I can do this. I can exceed your expectations. But the only way for you to do that and show them that is by having confidence in yourself. And of course, last but certainly not least, are your resume and your letters of recommendation. You want to make sure your resume is in tip-top shape. You want to make sure you have all of your school's information, all of the skills and things that you've learned. And again, I'm going to have an interview and like a resume type of video coming for you guys, so definitely stay tuned for that. I'm going to share with you guys what exactly I put on my resume to become a nurse extern. I think you guys would definitely benefit from that video. As far as letter of recommendations, you want to make sure you are not waiting until the last minute to request a letter of recommendation from professors. So honestly, what I would do is request them now, even before you decide to apply for a nurse extern position. It's always nice to have letters of recommendation on standby, ready to go, just so you know you're not waiting for, you know, your professor to send one over, because they are busy too. They have other students. They can't just, you know, sit down and write you a letter. So make sure you are prepared and ready to go. And a quick side note, you guys, the hospitals really do reach out. One of my professors, specifically my clinical professor, she told me like, hey, yeah, they called me, but you know, she said really nice things about me. She said that I was a good student. So that is just a side note. They really do reach out, guys. So make sure you are on point when it comes to the relationships that you have with your professors, as well as getting letters of recommendations. Okay, so now let's talk about my schedule as a nurse extern. So just to clarify, because I get a lot of questions, I get a lot of you asking me, am I, you know, part-time, am I full-time, or what? I am neither. As a nurse extern, I am something called per diem. So per diem means I am on a contract to only come in at least twice a month. That is the only way that I am able to keep my position at the hospital as a nurse extern. However, I do choose to work more than, of course, 2 days in a month, because y'all, I need money, okay? So I do work more than 2 days in a month. What I like to do is I like to work on Friday and Saturday night, because you guys know I am a night neuro nurse extern. So I do work overnight. I work from 7 p.m. to 7:30 a.m. But I do like to pick up extra days, because not only do I earn that money that I, you know, worked for that night, but also my job does have promotions where if you pick up extra days, then you do get bonuses. So it's that night's worth money on top of a bonus. So I typically work 1 week, I may pick up an extra shift, and then the second week I'm just working my Friday and Saturday. So I have a total of 5 days on my check. And again, I do work 7 p.m. to 7:30 a.m. so I am working 12.5-hour shifts, a total of 5 days if I choose to pick up 1 extra day. And that's usually all that I do. I only pick up 1 extra day, because you guys, those 12-hour shifts, they will get to you, okay? And by the way, I will have a how to survive a 12-hour shift, both day and night, coming up. So definitely check those out, because I did work both day and night shift. So definitely be on the lookout for that video. Now let's talk about pay. Now you guys know here on my channel, I do not share numbers. One, because they will most likely differ depending on where you live. And also, not all nurse extern positions are paid. So definitely look into that before, of course, you apply to a position. So here where I am, you do make more than a CNA, and typically here CNAs in the hospital make about $12 to $13 an hour. However, I have seen, like in nursing facilities, the CNAs will typically make about $10 an hour. However, as a nurse extern, although you do make more than a CNA, you do not make as much as a nurse. And I know down here typically a nurse will make about $27 to $30. So if I were to give you guys an average, you would be around about $20 to about $23 an hour. Again, working as a nurse extern, you do get paid very well, especially if, of course, you haven't had a job that pay as much. But you guys, keep in mind that these numbers may differ depending on where you live, what state you live, what hospital you are going to be working at, also what, you know, what time of the day or what day of the week you are working, because I do get paid differentials for working night shift and weekends, so which means I do get money added onto my base pay. So that's why I really don't like to share numbers, because numbers vary all the time, you guys. But the best resource that you can use to see how much the average nurse extern makes in your city or, you know, your state is to use Glassdoor. I actually used Glassdoor to see how much a nurse extern position would make at my hospital that I'm working at right now, and it was 100% right when I got the call from the recruiter and she told me my base pay. It was correct. So I highly recommend using Glassdoor. It's a great resource because, you know, you can see reviews from people who have worked that position or worked at the hospital before. You can see what they wrote and what they said about that hospital. So definitely look into Glassdoor. It is a great resource to, you know, see averages when it comes to hourly pay rates and salaries and things like that. The number one reason why I never used my CNA license was because I was making more working at a desk job than as a CNA, and of course that desk job allowed me to read my textbook or write a paper and things like that. So trust me, you guys, I get it. So definitely use Glassdoor as a resource. It is a great place to start. So you guys asked for me to share some experiences that I've had while working as a nurse extern. So again, working as a nurse extern, I've just got to see a lot of things, which is great, especially because I do not have clinicals right now. Of course, with COVID, a lot of hospitals do not want students in the hospital due to COVID, but I did get to see some pretty cool things while working as a nurse extern. You guys know that I got to work on the COVID unit. That in itself was like a war zone because the hallways were empty. People are walking around, you know, gowned up, respirators. That in itself wasn't an experience. I just get to do day-to-day things like passing meds, starting IVs. I mentioned this in my live with you guys that I actually just had earlier today. Some other cool things that I got to see, I got to actually bag my first dead body. So I got to toe tag and zip up my first body bag, y'all. I also got to see a prolapsoma. That was pretty crazy, actually seeing someone's intestines outside their body. That was pretty cool. I get to see rapid responses, so I get to see cold blues when people are coding and literally everyone is flooding into the room. They're, you know, grabbing the crash cart, they're cracking meds open, things like that. So I do get to see a lot as a nurse extern, but I definitely do get to see a lot as a nurse extern, and I think I'm even more grateful because, like I said, I'm not in clinicals due to COVID, which sucks, but I understand they're just trying to keep us safe. So yeah, I definitely highly recommend doing the nurse extern position if you have the opportunity to, especially if it's paid, because again, I understand, you guys, we need money. I understand experience is nice, but you know, going to a hospital for 12.5 hours without getting paid, it's not easy. So if the opportunity presents itself and it definitely, you know, fits your lifestyle, it's something that you can do, I definitely suggest hopping on it for sure. So before I go, I wanted to give you guys some advice regarding nurse extern. So the first piece of advice that I have is to definitely go in and state to literally everybody that you see that you are a nurse extern. And I also mentioned this on my live on Instagram, that you do wear the same colors as CNAs, which kind of sucks because, you know, if you see me from afar, you're automatically going to think that I am a CNA. Although my badge does say nurse extern, you will think that I'm a CNA. So I definitely suggest that you go in and say, hey, you know, I'm a CNA, I'm here to learn. I'm also, you know, here to do my CNA duties, but I want to learn. So if you have something that you're doing, if you need an IV started, please call me. This is my number. Give them your number and say, call me. Even if I have to watch, if you don't want me to do it, just call me, because you want to get those learning experiences. Also, if you have to, you know, push something on the back burner, not something important, not like if a patient has to go to the bathroom, do not push that on the back burner. But if you have to delay a patient's bath for 5 minutes so you can go and see a nurse suction a trach, definitely do it, you guys. This is your time to learn. This is your time to soak up as much as you can while in the hospital. Piece of advice number 2 is to definitely aim for the hospital that you want to work at as a nurse. Again, this is something that I did. You guys know that I want to be a trauma center nurse, and like I explained early in the video, there are only 2 here where I live. So I did have the top one that I wanted, and then there was the second option, but I was gunning for that top one and I got it. And the reason why you want to do this is because you want to have your foot in the door in the hospital that you want to work at as a nurse. If you show them while you are a nurse extern that you are on the ball, you are answering call lights, you're answering your phone, you're getting your tasks done, you are charting correctly, things like that, they actually see you and they watch you. And this is something that my manager actually said, both of my managers said on my interview, is they said this is the longest interview you will have of your life. This is a year-long interview, so they are watching you. However, if you do not get the position at the hospital that you want to work at as a nurse, it is okay. You can always apply outside that hospital once you get, you know, your license. Or you never know, you may want to begin working at that hospital. You may begin to like, you know, the people that you're working with. You never know. So always shoot for the hospital that you want to work at as an RN. However, keep your options open. Like I said, I had got responses from everyone. However, once I saw the one from the one that I wanted, I went with that. However, if they did not reach out, I was not going to put my life on pause for that one hospital. So my last and final piece of advice is to definitely remember that this is only temporary. I know some days will probably be harder than others. I know that we are going to school to be a nurse, but you know, this is our stepping stone. You know, this is only a milestone. Like my mom said, we are paying our dues. So remember that this is only temporary, you guys, and yeah, you'll get through it, I promise you. That is going to go ahead and conclude this video. I hope you guys learned more about what a nurse extern is, what their scope of practice is, requirements, and things like that. And of course, if I did not answer one of your questions, feel free to leave it down in the comments down below. You guys know I'm always in the comments answering questions and responding. And you guys know the drill. Until next time, I love you guys so, so much, and I'll see you in the next one.
I like me better when I was yours.